let's talk briefly about what a brain injury is. And I'm really going to focus today on the educational categorization of traumatic brain injury, because that's probably the most relevant to you when you're thinking about kids in your care. But that educational definition is defined by an acquired injury. So this excludes kids who had a congenital injury. So kids who were born with some malformation in their brain, kids who have cerebral palsy, who had anoxia at birth, kids who had a stroke in utero, kids exposed to alcohol or drugs in utero. So there are lots of kids who we know have insults to their brain that are not included in this definition. And typically, what I've seen, and you guys may tell me differently, is that in the educational system, those kids usually end up categorized in the other health impaired category most often, or sometimes are categorized in a learning disability category, which doesn't always fit them that well, but sometimes makes the most sense in terms of services and et cetera. So this definition requires that this injury is caused by an external force. So that external force can either be being hit by something, somebody hits you in the head with a baseball bat, right? Or it can be that your head hits something. So you fall off the slide on the playground and you hit the ground, right? Or you're in a car accident and your head hits the seat in front of you, okay? It can be an open or a closed injury. So in an open brain injury, there's a skull fracture. Okay, and in a closed injury, there isn't a fracture. And so this injury can both be open or closed. And it has to result in total or partial physical disability, psychosocial impairment, or both. And as I mentioned before, excludes congenital, degenerative birth injuries, a variety of other kind of brain-related impairments. So it's really in contrast to an acquired injury, which is an injury that could occur in some of those other ways I described before. So does that make sense? This is a very specific definition. Yeah. So let's talk briefly about how often head injuries occur and in whom they occur. This is data from the Centers for Disease Control, who publish this data on their website, and you're free to go and look at that if you have questions or that you want answered about this issue. And this shows cases per 100,000 people by emergency department visits, hospitalizations, or deaths. Okay, shows the number with a brain injury by age. So age is along the bottom, and number of people per 100,000 goes up the side. So what do you notice when you look at this graph? What hits you right away? 0 to 4 is high. Yeah. So kids age 0 to 4 are one of the reasons that the grant that we're working with has targeted this population is kids 0 to 4 at a high risk for a head injury. And if you look at the emergency department visits, that comes out a little bit clearer, which is the next most common age group just to have a brain injury. Teenagers and young adults, yeah. And then after that, senior citizens, yeah. Starts to rise again at age 65. Yeah. And the hospitalizations pattern follows kind of a similar pattern, just at a lower rate. And then deaths it follows kind of a flat pattern with a rise for folks who are more elderly. The point of this slide is that males are more likely to have brain injuries no matter what the age. Okay? That gender difference, closes up a little bit as folks enter their senior years. But in general, boys are more likely than girls to have an injury.
So they are more active, or what happens?
Maybe, yeah. So this looks at cause. Actually, Tina, you want to go back one slide? Okay, so without cheating, why do you think, unless you've already seen too much, but why do you think kids age 0 to 5 might be at higher, 0 to 4 might be at a higher risk? Shaken baby. So intentional injury. Shaken baby and child abuse, right? What else?
Their balance is
Right, so they got those big heads, right, and the smaller bodies, and their coordination isn't fabulous, and you spend most of their first 6 months of walking following behind them like this, right? Yeah. So their balance isn't great, and they fall a lot, yeah. What about teenagers? Why do you think teenagers? Driving. Yeah, driving. Yeah. And then what about senior citizens? Falls again, yeah. So if you go to the next slide, it just shows that. It's kind of divided in a funny way because there's this struck by and struck against category and then an assault category. But if you look at kids 0 to 4, falls are really the number one cause, right? Followed by being struck by or against something, which may in some cases involve abuse, right? Followed by motor vehicle accidents and assault. For teenagers, it's more likely to be a car accident or a fight, an assault.
So were sports not studied? Or?
Not in this particular study, yeah, and I think that's a really interesting thing to bring up because there's been a lot in the media lately about that, right, with sports and young children, and the recent brain injury conference, they talked about that a lot as well. Certainly sports are a concern, but I think we probably don't have great data on that yet. Yeah, at least on this large scale.
Do you think they could be included in the struck by or struck against category if they probably were
They might
identified
be.
with a concussion?
They might be, yeah. That's a good point too, that they might be in the struck by, struck against category as well. Yeah. Okay, so questions about that. Questions about what a TBI is and incidence and prevalence of traumatic brain injury. Okay, so let's talk about what happens when you have an injury. So, we're going to try to use some case studies throughout just to kind of make this a little more concrete and maybe a little more interesting. So let's start by talking about a case study, okay? So we have a little boy named Adam, okay? And Adam is 6 years old, and he's in the car with his mom one day, and they're driving, and he's not restrained in the vehicle, and their car is hit by someone else, okay? And so what happens when you're hit? Your car stops pretty quick, right? And he flies forward, and his head hits the seat in front of him, okay? So let's think about what happens to Adam's brain when this happens. So you've got this brain that's kind of suspended in this fluid in this kind of rocky, craggy skull. And so when his head goes forward, his brain is also going forward, right? And then it hits that seat in front of him, and his head stops, but his brain is still going, and it hits the inside of his skull. The first thing that happens is it hits that inside of the skull, and it may even scrape a bit up against that bottom kind of rough part of the skull. And so that part where the point of impact happens is called the coup injury, C-O-U-P. It's the coup injury, and it's that initial point of injury. And it doesn't have to happen in the front part of your brain, right? I mean, a kid gets hit on the side of their head, and that coup could be on the side of their head as well. But for Adam, it's right on the front part of his head. And then his brain is suspended in that fluid, right? So it bounces back, okay? And so at a point opposite where he was hit, his brain impacts his skull at that opposite point, okay? Also causing an injury, and that's called the contra coup injury, the contra coup injury. So there's the point of impact injury, and then there's the opposite point. And then also, that brain is suspended in fluid on top of that little, I talked about the marker in the basketball, right? It's on top of that spine. And it can move around a little bit. And so the other thing that happens is that tissue moves around, and it can get stretched and twisted, right? So when you think about all the long fibrous processes from the axons and dendrites of your neurons, and from those tracts in the brain, those can get stretched and twisted so that there can be some microscopic damage that occurs there too. Yeah. So that's kind of the primary mechanism of injury, is first the point of impact, that opposite point of impact, and then the twisting and shearing of those fibers. In addition, you can also get a hemorrhage if one of those blood vessels is ruptured in that initial injury as well, right? So think about what happens if someone hits you on your arm, and they hit you pretty hard, and it hurts. It doesn't break your arm, but it hurts. What happens? What do you form on your arm? A bruise, right? And kind of blood pools underneath there, right? And it gets kind of puffy, right? The same thing happens when you've essentially bruised your brain in the front and the back, right? As it gets kind of puffy and blood kind of pools there. The problem is you have space to go here, right? You can wear a loose shirt and your skin can swell. And it's not a huge problem. Your brain is constrained, right? There's only so much space. There's not a lot of space to go. So some secondary injury can start to happen due to that pressure, okay? So that swelling starts to happen, and then the tissue of your brain gets compressed in that skull, causing some other injury. In addition, swelling is just part of what our body does to help us heal, right? That swelling brings blood products that help us heal and can be helpful so the brain can swell. So you usually hear about it called edema, right? And that overall swelling, again, can cause that compression. If you have a hemorrhage, that can also cause some more pressure. So that pressure is a problem. If the swelling is enough that it blocks one of those places in those caverns where the fluid was flowing through so that it can't flow well, then you've got a problem, because that fluid is continually generating, as you remember. And so it builds up in those ventricles, and those ventricles get really full, and that can cause compression as well, right? So those are some of the secondary factors that can really create a lot of the injury that happens. And a lot of the medical intervention is around trying to minimize those secondary mechanisms as much as possible. If the swelling gets bad enough, what will happen is your brain will do this thing that is awful and has an awful term with it called herniate. And what that means is that hole, remember that hole that the spinal cord goes through? That brain tissue can become so tight, there's no space for it to go, that it starts to push through that hole. And if you remember, what was the structure right above that hole? The brainstem, right? And so a lot of times if you have a moderate to severe injury, what the physicians are really worried about is making sure that does not happen, because that is what will cause death fairly quickly for someone. So a lot of the treatment that happens, and Dr. Bent will talk about that, is aimed towards keeping that swelling from causing those secondary injuries. Okay? So it becomes really important to measure how severe these injuries are, because that tells us something about what the outcome might be, and Dr. Bent will talk about that in more detail. But I wanted to just mention some ways that we measure severity. And thank goodness for Dr. Bent, because she fixed the slide. It did read rage instead of rate. I don't know why. And I was looking at it this morning, I thought, that's not going to work. So one way that we figure out how severe an injury is by looking at a child's behavior right after they're injured. Okay? And so this is a standardized way of rating a child's behavior after they're injured. It's called the Glasgow-Coma scale, and if you're ever looking at medical records on a child that you're working with who's had an injury, this is something to look for. And oftentimes it'll be abbreviated GCS in their medical records. And so this rates, is a child opening their eyes? And are they doing that spontaneously? Okay? Or are they doing it in response to someone's voice or to pain? Or are they not opening their eyes at all? Then there's a rating for their verbal behavior. Are they talking at all? And when they're talking, is it making any sense? Okay? And then there's a rating for motor behavior, which is a lot like the rating for the eye opening. It has to do with, are they moving spontaneously and with some purpose? Okay? Or are they just moving if they feel pain? And is their movement localized, like if you pinch them on their right arm, are they flinching with their right arm, or are they just kind of generally moving? Okay? So let's say with Adam, he's in that car accident, and when the paramedics come, they notice that he's not opening his eyes, okay, except to pain. So they pinch him, and he opens his eyes briefly. And then they notice that he's talking, but it doesn't make any sense. And if you ask him a question, it's completely unrelated to whatever you asked him. And then they also notice that he's moving, but there's no pattern to his movement. It's just kind of agitated and purposeless kind of movement, okay? So they would add up those, they would score each of those areas and then add up those scores to get an index of severity. And so for Adam, his rating was a 9, which puts him kind of right on the cusp of this moderate to severe range, okay? In contrast, let's say you have a little girl named Tasha, and she is playing on the playground. She's 4, and she's playing on the playground at school, and she falls off the slide. That's pretty high, and she falls off the slide, and she hits her head. And the teacher goes to get her, and she's super confused. She's kind of wandering around, and she's not making a lot of sense, but her eyes are open, and she's answering you. She just looks really dazed, okay? And is kind of confused. And a mom comes to get her and puts her in the car, and she throws up and just seems really kind of confused. So if they rated her, she probably, her eyes are open. She's moving purposefully. The only issue really is that she's not responding verbally the way you would expect her to. And so she'd probably have a coma scale that was about 13 or 14, okay, which would place her in that mild range, okay? The other way that we measure severity is by post-traumatic amnesia. And you all are probably aware that in the media, amnesia is what is most often associated with brain injury, right? And there are always these kind of dramatic depictions of someone who has their brain injury, has a brain injury and forgets who they are and doesn't remember anyone in their life. And that's not really the kind of amnesia that we see in a brain injury, okay? What we usually see is there may be some concerns about past memories that are the most fragile memories, the memories that were pretty recent, okay? And so they're the ones that weren't quite consolidated and solid in your brain, okay? So there may be some difficulties there. But the more common difficulties are with laying down new memories, okay? So for example, Adam, after his injury, he's disoriented, he's confused, he goes to the hospital, and during his hospital stay, his family notices that he keeps asking why he's there once he starts really talking. Why am I here? How did I get here? And they tell him over and over again, you were in a car accident. And it just doesn't sink in, right? And he has the same nurse almost every day, and he has no idea who she is and needs an introduction every time she comes. And his friends and relatives come to visit, and Mom says, hey, remember when Dad was here yesterday, or Uncle Ned? And he says, no, he came, okay? So just not being able to lay down those new memories afterwards, okay? For a kid like Tasha, what you may find is that she's kind of confused and doesn't seem to be laying down new memories for a few minutes or so. For a kid like Adam, this lasted, about 9 days. And so that period of time when a kid is confused and disoriented and doesn't remember continuous events, or if they're remembering, their memory is super spotty, so they have these kind of strange memories where they remember bits and pieces. Okay, that's called the length of post-traumatic amnesia. And that length is a good way to measure severity. So 24 hours or less of PTA, which is the shorthand for post-traumatic amnesia, PTA, which you might also look for in the medical record. 24 hours or less is considered mild. From a day to 7 days is moderate. And more than 7 days is severe. So Adam at 9 days is reaching that severe range. Now this index can get a little confusing because for a lot of kids, medically we induce a coma to try to help right away, to try to help with that secondary injury piece. And so this can be a little bit more confusing to figure out, but it still is pretty helpful. And sometimes there are kids whose Glasgow coma scale looks pretty good, but then have pretty long post-traumatic amnesia, and that kind of gives you a hint that their injury was maybe a little more severe than initially suspected. For a kid like Adam, what we did is we gave the Children's Orientation and Amnesia Test, which is a scoreable test that you compare to other kids their age, and ask questions about how old are you and what's your name and who do you live with, so orientation questions, and then ask memory questions, like giving him a string of numbers that he has to repeat back to you, okay? And you score that up, and you can give it repeatedly so that it tells you when they come out of that post-traumatic amnesia fairly specifically. And then obviously, medical scans can also tell you about severity, right? The thing to remember about scans is that they can be limited based on what you can see in that particular kind of scan, okay? So a CAT scan is like a three-dimensional x-ray, right, essentially. It really looks at surface structures. So a kid like Adam, you're going to look at a CAT scan and you're going to see a hematoma in the front, and you may even see a small contracture hematoma in the back, but you're not going to see a whole lot more. A kid like Tasha, you're going to see nothing. It's going to look fine, okay? An MRI may show you more. So a kid like Adam, it's probably also going to show small lesions, probably right next to the ventricles, from that twisting and shearing and those kind of more microscopic kind of injuries. And a kid like Tasha, you might see something like that, you might not, okay? So they can be helpful, certainly if there are obvious anomalies on an MRI, you know that your injury is at least in the moderate, if not severe range, and it can tell you something about severity, but there are some limitations. And so really the combination of imaging and behavioral indexes is going to give you the best idea of where a kid is in terms of severity.